There we go. I got this in the mail today. I'll read it to you. From the Department of Health and Human Services, Public Health Service, Centers for Disease Control and Prevention, National Center for Health Statistics, 3311 Toledo Road, Hyattsville, Maryland, 20782, from the Director of the National Center for Health Statistics. I am asking you for your help with an important study conducted by the Centers for Disease Control and Prevention, CDC, called the National Immunization Survey, the NIS. This survey tells us which vaccines people in the U.S. have received and about other important health topics. Results from the NIS are used to help health officials in their efforts to improve healthcare programs. In the next few weeks, the National Opinion Research Center, NORC, at the University of Chicago will call your household to take part in this study for CDC. For this study, we need to ask about vaccinations and children's health. Some households also may be asked questions about the health services their children need or use. If you have a child between 18 and 35 months of age, it would be helpful to have your child's immunization records handy when answering our questions. However, you can also answer these questions without the record. Your phone number was chosen randomly by computer. It is important for us to interview every household we call to get a complete picture of your area's immunization rates and key factors that might affect them. The study is important, but you do not have to take part. That's a good thing. Or you can decide not to answer one or more questions. So if I decide not to answer more questions, does that still constitute taking part? Never mind. You may call this toll-free number at 1-866-999-3340 if you would like to take part in the study now. You can also call this number to learn more about this study and what you will be asked. For more information, turn this letter over or go to the study's website, http://www.cdc.gov/NIS. Your answers to the NIS will provide information to help improve the nation's health now and in the years ahead. We need your help to make this study a success. We hope you will decide to take part when we call. Thank you for your cooperation. I am grateful for your help. Sincerely, Edward J. Sundick, Ph.D., Director, National Center for Health Statistics, Centers for Disease Control and Prevention. Now, I reserve all my rights but when I turn this over, okay? I'm just looking. It's in my house. I can do that. NORC toll-free number 1-866-999-3340. You can call the NORC toll-free number to take part in a study right away, learn more about the study, and hear what you will be asked. Who sees my answers? You will be called by a trained interview who enters your answers into a computer. Everyone who works on the survey I'm sorry, this struck me funny the first time. I didn't think you'd get me this time. Everyone who works on the survey must sign an oath that promises they will never give out anyone's personal information. Only a few people who work on this survey will ever see any personal information. Answers that could identify you or your family in any way are separated from your other answers. Survey findings are put into summary reports that contain no names or other information that identifies you. How do you protect my information? Your answers are used for health research purposes only. We conduct this survey under the Public Health Service Act. It and other strict U.S. laws require that we protect your family's information and keep it confidential. If you would like to know more about how we protect your answers, these laws are described in detail at www.cdc.gov/about/policy/confidential HTM. If you want to know more about your rights as a study participant, you may call 1-800-223-8118, extension not, toll-free. That means it's toll-free, no extension. Some people understand my English, or lack thereof. This is the number for the Research Ethics Review Board at CDC. You will be asked to leave a message. Say you are calling about Protocol 2006-4. How do I find more about immunizations and places to get them? You may call toll-free 1-800-CDC-INFO, 1-800-232-4636. For more information about vaccinations or to get the phone number of a doctor or clinic near you. If you prefer to use a TTY, please call the AT&T Relay Service at 1-800-855-2880 and request that NORC be called at 1-866-999-3340. NIS Q2-2010. That's it. The thing that really struck me was where they say answers that could identify you or your family in any way are separated from your other answers. And then what? Survey findings are put into summary reports that contain no names or other information that identifies you. Now, if there are answers that could identify you or your family, they're separated from the other answers. The survey findings are put into summary reports that contain no names or other information that identifies you. What happens to those answers that could identify you or your family that have been separated from the other answers? Presumably the ones used in the report, the summary. It sounds like they're not telling the whole truth here, doesn't it? And for the girl that said I had Richard Pearl eyes, Richard Pearl, what a dick. Well, just want to get that out. You're all, you know, I deal only in facts, so make what you will of it. I might have some fun with it yet. I'm not sure yet. It depends. I have a lot going on right now, so we'll see. Have a good night.